There is a network problem today. I don't know. So this pituitary gland, it will release the hormone whenever we need about it. So it will releases two hormone. One is antidiuretic hormone, and the second is the oxytocin hormone. So that we had seen what is the important functions of it and the disorders which are related with it, that we had seen. After that, we had seen about the pineal body or pineal gland. So this pineal gland, it is it secreted the two hormones, melatonin and the serotonin. Melatonin, it is the sleep inducing hormone that I had told you. After that, we had seen about the thyroid gland, which is the most important gland, and it is the largest endocrine gland. Okay, so this gland, it is larger in the female as compared to male, and so most of the females, they get sufferer from this disorder related with the thyroid gland. So this thyroid gland, it secretes two hormones, thyroxine and second is the thyrocalcitonin, or it is also called as calcitonin. So thyroxine is more important as compared to other hormones because it regulate all the metabolic functions, BMR, that is basal metabolic rate in our body, and that's why if the secretion will be less or more, we will suffer from so many disorders. Then that we had already discussed yesterday. After that, we had seen about the parathyroid gland. So parathyroid gland, it is just embedded to the thyroid gland. These are four in number, and it secrete only single hormone, that is the parathormone, and which will control the calcium metabolism, or it controls the calcium in the body. Then the next one, which we had seen, that was the thymus gland. Thymus gland, it is present near the heart, and this thymus gland, it secretes thymosin hormone, which is responsible for development of lymphocytes, as well as it is useful for the formation of antibodies. Okay, so up to this, yesterday we had studied. Now let's see about the adrenal gland. So this adrenal gland, it is also called as suprarenal gland because it is present on the superior surface above the superior, we can say superior surface or above the kidney. So this adrenal gland, it has a dual origin. It is developed from the mesoderm as well as ectoderm. And this gland, it is yellowish gland, and it consists of two regions. The outer region is called as adrenal cortex, and the inner region is called as adrenal medulla. So adrenal cortex, it consists of three regions. One is zona glomerulosa. So this zona glomerulosa, it is the outer part of this adrenal cortex, and it secretes mineralocorticoids. So these mineralocorticoids, it will regulate sodium and potassium ion concentration in the body. They also regulate water and salt balance in the body. Okay, so here they are responsible for maintaining blood volume. They are responsible for maintaining blood pressure also. Then here aldosterone is the example of this mineralocorticoid, which balances the sodium and the potassium level in our body. Then the next one, the middle zone, is called as Zona Fasciculata. This Zona Fasciculata, it is responsible for secretion of glucocorticoids. So the main glucocorticoid is cortisol. This regulate the metabolism of carbohydrate, protein, and lipids. Cortisol, glucocorticoid, it is responsible to increase the blood sugar level in the body. It is immunosuppressive, and it suppresses the synthesis of antibodies in our body. So it is used for the treatment of allergy. अगर किसी को एलर्जी है तो वो सेंसिटिव रहेगा, तो इसलिए इसका यूज किया जाता है. It prepares from the animals to face the emergencies in human beings. Then the next innermost layer or innermost region in the adrenal cortex is called as zona reticularis. This zona reticularis, it is responsible for the secretion of sex corticoid. So gonadocorticoid or sex corticoid is secreted here. In male, they will responsible for development and maintenance of external sex characters. Excess sex corticoid in female, it will cause adrenal virilism or hirsutism. तो ये क्या है विरिलिज्म या हिरसुटिज्म? तो फीमेल में अगर ये सेक्स कॉर्टिकॉइड का सिक्रेशन बहुत ज्यादा होता है, तो देयर में बी सम फीचर्स which are present in the male, we can see in the female body, like यहाँ पर जो है तो hairs grow होना, फेस पर बहुत ज्यादा अगर hairs grow हो रहे हैं तो that is called as hirsutism. So this we can see when there will be more secretion of sex corticoid. And in male, gynecomastia we can see. What is the gynecomastia? Gynecomastia means when the breast enlargement will be seen in the male, then it is called as gynecomastia. Androgen and estradiol, these hormones, they are produced by this adrenal cortex. Do you understood? Now here the middle part or the inner part of this adrenal gland is called as adrenal medulla. This adrenal medulla, it secretes two hormones, adrenaline and noradrenaline. Adrenaline, it is also called as epinephrine, and noradrenaline, it is called as norepinephrine. Adrenaline, it is called as emergency hormone. So here, fight, flight, and fright, these three F, they are used for the function of it. तो जैसे fight, तो अगर हमें fight करनी है तो that will be emergency condition to protect our body. Flight, जब कहीं हमें इमरजेंसी लैंडिंग करना है तो हम फ्लाइट का यूज करेंगे. एंड फ्राइट मीन्स टेरिफिक फियर जो रहता है, बहुत ज्यादा जब हम डरते हैं तो दैट इज कॉल्ड एज फ्राइट. तो ये तीनों कंडीशन में एड्रेनालिन हार्मोन जो है तो वो रिस्पॉन्सिबल होता है. जैसे कि मैंने आप लोगों को बताया था कि यहाँ पर जो है तो जब भी हमारे सामने जैसे कोई इमरजेंसी कंडीशन आ गई, कोई जो है तो स्नेक सामने आ गया या टाइगर सामने आ गया, तो जो पर्सन उठ के चलता भी नहीं होगा तो वो दौड़ जाए, है ना, क्योंकि उसको खुद की जान बचानी है. तो ऐसे समय में ये एड्रेनालिन हार्मोन जो है तो वो हमें हेल्प करता है. एंड नॉरएड्रेनालिन दैट विल रिड्यूस द ब्लड प्रेशर so that it will become normal condition. Vasoconstriction का काम करता है. ठीक है, तो these are the normal functionings of these hormones. Then let's see some disorder which is related with this gland. So the first disorder is hyposecretion of either mineralocorticoid or glucocorticoid is responsible for Addison's disease. So in Addison's disease, there will be low blood sugar, there will be low sodium and potassium ion concentration in the plasma, there will be increased loss of sodium ions and water in the urine. And here, due to all these things, the weight loss will be there, weakness will be there, nausea will be there, vomiting or diarrhea may occur here. What about the hypersecretion? The hypersecretion of this glucocorticoid, it will lead to Cushing disease. So in Cushing disease, the blood sugar level will be high. There will be excretion of glucose in the urine. Then there will be rise in the potassium ion concentration in the blood. High blood pressure, there, obesity will be there, and there will be wasting of the limb muscles. Wasting of limb muscles means, तो हमारे जो limbs है, यानी हाथ और पैर जो है, तो वो बहुत ज्यादा वीक हो जाएंगे और उसके मसल्स जो है तो उतने एक्टिवली वर्क नहीं करते. तो ये जो है, these are the disorders which are related with this adrenal cortex or the adrenal gland. Do you understood? Yes or no?
Yes, ma'am.
The next gland is the pancreas. I had told you that pancreas, it has a dual function actually, and so it is called as heterocrine gland or the mixed gland. So the endocrine part of this gland is called as islets of Langerhans, and this islets of Langerhans, it secrete 4 types of hormones here. So that is alpha cells, beta cells, delta cells, and the PP cells or F cells are present here. These cells, they will secrete 4 types of hormones. So first, alpha cell will secrete glucagon. This glucagon, it will stimulate the liver for gluconeogenesis. So gluconeogenesis की प्रोसेस करेगा, जिससे क्या होगा, तो ग्लूकोज लेवल जो है हमारे ब्लड में वो इंक्रीज हो जाएगा. Then the second cell, that is the beta cells. These beta cells, they will secrete insulin hormone. What is the function of insulin hormone? So insulin hormone, it will again stimulate the liver and the muscles so that glycogenesis process will occur. And because of this, the blood glucose level will get decreased. Okay. Then third is the delta cell. Delta cell, it secretes somatostatin hormone. So this somatostatin, it will inhibit the secretion of glucagon and insulin. Inhibit यानी कम करवाएगा. It will decrease the gastric secretion. It will motility and the absorption of the digestive tract, so that यानी बहुत ज्यादा absorption नहीं होना चाहिए. Then PP cell or F cell, so they will secrete pancreatic polypeptide. These will inhibit the release of pancreatic juice. बहुत ज्यादा एक्सेस में जो है तो वो नहीं होना चाहिए, पैनक्रियाटिक जूस का सिक्रेशन नहीं होना चाहिए, इसलिए ये पीपी सेल जो है जो पैनक्रियाज में प्रेजेंट है तो दे विल inhibit that function. So what will be the disease related with this? So due to pancreas, one disease which is called as, which is most common disease present in our surrounding, and that is the diabetes mellitus. Diabetes mellitus, it is also called as hyperglycemia. सिंपल इसमें कहा जाए तो जब हमारे बॉडी में शुगर की लेवल बढ़ जाएगी तो दैट इज द डायबिटीज मेलाइटस. So it is most common metabolic endocrine disorder, and which is due to the disturbances in the pancreas. So here what will happen? So there will be increase in the blood sugar level will be there, because beta cell which secrete insulin, so that secretion will get reduced. So in children, if it is present, then it is called as insulin dependent diabetes mellitus, यानी type 1 diabetes mellitus जिसे कहा जाता है. ठीक है. और यहाँ पर जो है तो दूसरा जो होता है तो दैट इज द नॉन इंसुलिन डिपेंडेंट डायबिटीज. तो नॉन इंसुलिन डिपेंडेंट डायबिटीज, दैट इज द टाइप 2, and it is caused due to failure in the insulin to facilitate the movement of the glucose into cell. हमको ग्लूकोज की जरूरत है एनर्जी के लिए, तो अगर इंसुलिन ही है कि वो ग्लूकोज में उसको कन्वर्ट कराता है, लेकिन अगर वो नहीं कर पाया तो देन we will suffer from this diabetes mellitus type 2. Okay, so here reduced sensitivity to insulin, it is called as insulin resistant, which we can see in this diabetic person. So here whether it is insulin dependent diabetes mellitus or the non insulin dependent diabetes mellitus, in both the cases the sugar level or the glucose level will be increased in the body. So because of it, the person may have excessive urination, dehydration of the body tissues will be there, the person will feel hungry anytime, there will be degradation of fat, and because of it the ketone bodies will be deposited in our body. Then here the weakness, severe weakness will be there in the diabetic person. For that we have to give insulin, which will decrease the glucose level in the body. So this is all about the pancreas. The last gland is rumen, and that gland is gonad, 6 gonad or 6 glands. So here in male and in female, different glands are there. So firstly we will see about in male. So in male, testes are there. These testes, they will secrete male sex hormone, which is called as androgen, means testosterone hormone. So testosterone hormone, they are secreted by interstitial cells, or they are also called as Leydig cells, and they are secreted due to the influence of luteinizing hormone, which is the gonadotropic hormone secreted by pituitary gland. So when the testosterone level will become high, so they will inhibit the luteinizing hormone secretion. So here this testosterone hormone, it is responsible for secondary sexual characters in male, like the facial and the pubic hairs. The hairs grow on the armpit, in the on the genital organs. Then there will be broadening of shoulders, changes in the voice, aggressiveness, all these things. Again, development of here Adam's apple. So these are all functions are the testosterone hormone. Then what about in the female? In the female, ovaries, they are produce hormones. So ovaries, they produce 4 types of hormones. One is estrogen hormone. So this estrogen hormone, it is secreted by ovarian follicle. So here it is responsible for secondary sexual characters in female, like in male. So secondary sexual characters, menstrual cycle, and the hairs grow on our body, all that. Then progesterone hormone. So progesterone hormone, it is secreted by corpus luteum when the ovulation process takes place. So the ovarian, empty ovarian follicle, that convert into corpus luteum, and this corpus luteum, it will secrete progesterone hormone, which will maintain the pregnancy. Then here the third hormone is relaxin. So this relaxin hormone, it is again secreted by corpus luteum at the end of gestation period. जब gestation यानी pregnancy period जो है, तो ये end होता है, that time it will secrete. So it will relax the cervix of the pregnant woman and ligaments of pelvic girdle so that the birth of young one should take place easily. Then inhibin. So inhibin again it is secreted by corpus luteum, and inhibin it will inhibit the follicle stimulating hormone and the gonadotropic releasing hormone production. So this is all about the hormones, okay, which are secreted by these glands. Beside this, placenta, it is a temporary endocrine gland. So that is not in your syllabus, but still I am telling you that placenta it secrete human chorionic gonadotropic hormone, so by which our pregnancy test becomes positive. So it releases in the urine, and due to this, the pregnancy test becomes positive. उसके बाद में कुछ जो है तो जैसे हमारे स्टमक है, किडनी है, दे आल्सो सीक्रेट सम हार्मोन्स, तो गैस्ट्रिन, सिक्रेटिन, कोलेस्टोकाइनिन, एंटेरोगैस्ट्रॉन, ये हार्मोन्स जो है तो हमारा स्टमक सीक्रेट करता है। किडनी जो है तो रेनिन, जो कि हमारा ब्लड प्रेशर रेगुलेट करने के लिए हेल्पफुल होता है। एरिथ्रोपोइटिन आरबीसी फॉर्मेशन के लिए रिस्पॉन्सिबल होता है। कैल्सिट्रियोल, ये जो है तो ये किडनी सीक्रेट करते हैं। एंड हार्ट जो है तो एक एट्रियल नाइट्रियूरेटिक हार्मोन जो होता है उसका सिक्रेशन करते हैं। तो दिस इज ऑल अबाउट द हार्मोन्स. डू यू अंडरस्टूड? Do you understood all these hormones?
Yes, ma'am. Yes, ma'am.
Okay. So, beta, from module 3, I have completed endocrine system. So, I have completed a listing of endocrine glands and their location, then functions of the pituitary, thyroid, parathyroid, and the adrenal gland. So, all these things I have completed. Now, the only thing is remain, that is the reproductive system. So that I will take it tomorrow. Today I am taking here some, just say, physiological changes in the pregnancy that I am going to take now. Okay. So here, what do you mean by pregnancy? The pregnancy, it is the condition, it is not a disease actually. It is the condition in which the uterus in the female, it will carry one or more than one fertilized ovum, or we can say which will carry one or more than one
मैम
embryo. हाँ बोलो बेटा.
मैम एक्ने के बारे में मैंने उस दिन आपको कहा था, वो रह गया है तो?
हाँ बेटा, I know about it. तो लेट्स कंटिन्यू विद दिस, क्योंकि अभी जैसे हार्मोन लिया ना, तो वो हार्मोन से रिलेटेड ही मैं कंटिन्यूएशन ले रही हूँ. ठीक है. तो हियर ड्यूरिंग प्रेगनेंसी, one or more than one, I am saying, embryo will carry with the uterus. So यहाँ पर there may be some changes occur during pregnancy. Why the changes occur? Because there will be development secretion of some hormones. Just now we had seen कि कुछ हार्मोन्स का सिक्रेशन होता है. वो जो हार्मोन्स का सिक्रेशन होता है तो उसकी वजह से हमारे बॉडी में काफी चेंजेस होते हैं. तो लेट्स सी व्हाट विल बी द फिजियोलॉजिकल चेंजेस दैट टेक्स प्लेस ड्यूरिंग दिस प्रेगनेंसी. तो ड्यूरिंग प्रेगनेंसी here some emotional as well as physiological changes will occur, and these changes, they may be the natural part of pregnancy. And here if we know about that, so definitely we can control that particular person. So pregnancy, it is the growth of uterus and the embryo. So fertilization and early embryo formation, uh, that that will change in all the body systems. So here, why these changes occur? So that our body will prepare and help the pregnancy development, so that successful childbirth will be occurred. So each woman is affected differently in this situation. Just understanding changes and effect of various body system, it will be help to understood exactly what changes going on during pregnancy. Because of it, the anxiety will get reduced, unnecessary tension will get reduced during that pregnancy period, and some of the symptoms, they will go away automatically. Okay, so here let's see. Normally, the weight of the uterus is 60 gram, and uh, during pregnancy it will increase, and its weight will become 1 kg near about. Okay, because the placenta formation will take place. So how this placenta formation takes place, that we will see later on, and there will be accumulation of fluid, and because of it, the size and the weight of the uterus will get increased. So see, what are the common physiological symptoms during this pregnancy? The first symptom which we observe, that is the frequent urination. Here, most of the female, they get suffer from frequent urination. Why? Because the reason is that uterus is present behind the urinary bladder in female. So this uterus, as it will increase in size, so that will give pressure on the urinary bladder. As it will give pressure on the urinary bladder, there will be a problem of urinary frequent urination, or there will be continuous urging to urinate. तो यहाँ पर जो है इसके लिए बहुत हमको मेडिसिन लेने की जरूरत नहीं होती, and most of the female, what they don't drink water during this time, as they are having continuous urging to urinate. So we should take sufficient amount of water, so that whatever impurities, whatever waste are there in our body, so that will remove from the urine. Then the next is heartburn. हार्टबर्न का मतलब होता है मराठी में जिसको जड़की लागने, यानी हमको जो है तो एसिडिटी की जो तकलीफ होती है, दैट इज द हार्टबर्न. तो यूट्रस अगेन इट विल गिव, as the uterus is growing, so that will give pressure on the stomach. So if we take a little amount of food, that will lead to heartburn. So here, avoid spicy food, fry food, oil, or eating almond and ginger. So that will reduce the heartburn. And we should take a lot of water with small sips. बहुत जल्दी से ना लेते हुए थोड़े थोड़े small sips हम लेते हैं, so definitely it will reduce the heartburn. Again, lying on the left side with the supporting pillow, or half sitting position, that will also reduce this heartburn. So after taking meal, we should walk some distance, that will again reduce. After eating, we should not lie down immediately. So all these will reduce the heartburn. The next is nausea or vomiting. Most probably हम फिल्मों में देखते हैं कि किसी को nausea और vomiting की feeling है, so that is the sign of pregnancy. So most of the female, they have these symptoms during pregnancy, and that's why they show like that. But always nausea and vomiting is not the sign of pregnancy. Okay, nausea and vomiting, it is caused due to the hormonal and the chemical changes which are going on during this period. So most probably in empty stomach there will be feeling of nausea. So before means बेड से उठने से पहले जो है, तो if we are taking some biscuits, so that will reduce this nausea getting out of bed. So if we will eat some biscuits, that will reduce this nausea or vomiting feeling. Then fatigue. There will be fatigue due to the progesterone disturbances. So it is the sign that you need a rest. You should take a rest. Then sleep disturbances we can see during this period. So this sleeping disturbances mostly due to frequent urination, or if we are having habit of lying down on the abdomen, and definitely we will not be able to lie down on the abdomen as the uterus will get compressed. So because of this, there will be sleeping disturbances, or sometimes due to fetal movements or due to stress or worries about the pregnancy, we may have these sleep disturbances. So what can we do for that? So avoid to take coffee, use soft cushion so that it will feel comfort. Then just avoid the fears or anxiety, or avoid the stress, so that you can sleep properly. Don't take any sleeping pills for that. The next is constipation. Constipation, it happens as there will be decrease in the intestinal functions. So here, the large intestine or the colon, it will absorb lot amount of excess amount of fluid due to the rise in progesterone hormone, and because of it, there will be constipation. Or if we are not taking proper nutritional diet, so definitely that time it will leads to constipation. For that, what we have to do, we should take at least 2 to 3 liters of water every day. We should take a glass of hot water in the morning before meal, so that it will reduce the constipation. We should eat fibrous rich foods like fruits, seasonal fruits, vegetables, then some dry figs, that will help us to avoid this constipation. And again, we should do our daily activities. We should do some walking, which will reduce this constipation. Then the next one is the hemorrhoids, जिसको हम बवासीर या पाइल्स बोलते हैं. So hemorrhoids, that is occur due to expansion and congestion of blood vessels. So if we want to avoid this or prevent the hemorrhoids, we should avoid constipation by drinking lot of water. Fluids means we should take juices, again fibrous food. It should get included in our diet. Because of it, we can prevent the hemorrhoids. Again, hemorrhoids can be treated by taking warm water sitting. तो वार्म वाटर सिटिंग करते हैं तो उससे भी हम जो है अवॉइड कर सकते हैं. देन द नेक्स्ट वन इज द बैक पेन. बैक पेन ड्यू टू चेंज इन द सेंटर ऑफ ग्रेविटी, वेट गेन हो रहा है, मसल्स का टेंशन जो है वो इंक्रीज हो रहा है, और जो स्टेबिलिटी है हमारे बॉडी की वो मेंटेन करना है. बिकॉज ऑफ ऑल दिस थिंग्स वी मे गेट सफर फ्रॉम द बैक पेन. तो यहाँ पर रिलैक्सिन और प्रोजेस्टेरॉन हार्मोन जो है तो वो कई बार क्या करेगा, दैट विल सॉफ्टन द लिगामेंट्स, joint laxity, instability, and because of this we may get suffer from back pain. So back pain that can be reduced by doing some exercises like बेसिन को रोल इन करना है, एक करेक्ट पोस्चर में बैठना, वॉकिंग करना है, या फिर हम जो है तो जो क्लॉथ्स हम पहनते हैं तो अगर हम कंफर्टेबल क्लॉथ्स पहन रहे हैं या कंफर्टेबल शूज जो है तो वो हम पहनते हैं, बैक रब करना या प्रेशर अप्लाई करना, तो by this we can reduce the pain. Again, जो भी हम ऑब्जेक्ट उठाते हैं तो उस समय में स्ट्रेट होकर फिर उठाना, ऐसे बेंड कर कर ना उठाना, तो इससे हमारा पेन रिड्यूस्ड हो जाए. देन लेग क्रैम्प्स. तो लेग क्रैम्प्स यानी पैर में मरोड़ होना, तो ये मे बी the absorption of calcium will be less, or there may be lack of blood supply in the lower extremities, and because of this we may get suffer from the leg cramps. To relieve the leg cramps by for that what should we do? To lift the legs. हमारे जो legs है तो ऐसे ना रखते हुए ऐसे एलिवेट करके रखेंगे, तो इससे क्या होगा, डेफिनेटली हम लोगों को रिलीफ मिलेगा. एंड व्हेन जैसे हम सिटिंग कर रहे हैं तो वी शुड नॉट हैंगिंग डाउन आवर लेग्स. इफ दे विल बी स्ट्रेट so that time we will get the relief, or apply any ointment or massage oil by which we will get the relief. Don't take painkillers. Then swelling of hands and feet. So swelling, it occur because of accumulation of fluid during this pregnancy. So we should not wear tight jewelries like rings or piles and bangles. Then and again we should elevate our legs during rest position and wear comfortable shoes, that will be okay for it. After that varicose veins. तो varicose veins यानी जो हमारे legs जो है तो वहां पर हम लोगों को ग्रीन कलर का जो veins का नेटवर्क दिखता है, तो when it will become prominent. Why it will become prominent? Due to the expansion and vascular congestion. Varicose vein mostly occur in the legs, vulva, and the anus. To relieve from it, again elevate the bed at least 10 centimeter जो है, तो हमारा बेड जो लेग्स के साइड से जो है तो अगर हम एलिवेट करते हैं that will reduce our problem. Again जो है तो elastic socks जो है तो if we will wear it, it will give relief to, from this varicose veins. Then some female, they may get suffer from gum diseases. So gum diseases that is occur as the gum blood vessels, they get influenced during this period. So pregnancy progress the gum, and we may have some swelling or bleeding from the gums. So we must brush our teeth at least twice a day, so that we will relieve from that. Or if you have any problem, so you can contact with the dentist also. Then anemia. Anemia, it is the common problem during pregnancy, and here due to anemia the female will feel continuously tired, feeling will be there. So to prevent from this, we should eat apples or green vegetables, broccoli, lettuce, or we must eat nuts, egg yolk, red meat, or whole grains from by which we can prevent this anemia. Again, take iron tablet as a supplement. Then darkening of skin. Most of the female, they get darkness here on the neck and on this uh, face part. So here, this darkness, it is due to the changes in the hormone. So that brown spots around the eyes, nose, that can appear during this third trimester period. Means जब 6th-7th month चलता होता है, उस समय में ये darkness आता है, and it will disappear after 6 to 1 year, or 6 months to 1 year after delivery. But most of the female, they remain these spots for a longer time, and because of it, their face that looks not good, है ना? Then mood swings. So mood swing, it is again due to the changes in the hormone, anxiety, how and when my baby will take birth, and because of all these things, there will be mood swings. So often, heart to heart talk will improve your mood and the situations in general. So these all are the changes which takes place during pregnancy. These all are the physiological changes. Do you understood, Beta? Do you understood, all of you?
Yes, ma'am.
Yes,
Now,
ma'am.
the common problem, common question most probably asked, and it is having important topic also, that is the importance of breastfeeding. The question arises, why the breastfeeding is important? Breastfeeding, it is baby which is exclusively in first 6 months get food supply from the breastfeeding, है ना? After that, we can give some additional supplementary foods in the form of some maybe paste form, or in the semi-solid form, or in a liquid form. So what is the importance of breastfeeding? So breastfeeding, it will assist the uterus to return to its pre-pregnant position. जो हमारा पहले यूट्रस था, तो वो प्रेगनेंसी के पहले जो था वैसे ही वापस से आने के लिए ये हेल्प करेगा. It can help woman to lose the weight which she had gained during pregnancy. Then reduce the risk of ovarian cancer or the premenopausal breast cancer. It will reduce the risk of osteoporosis. It will reduce the risk of mothers with the gestational diabetes, which will develop type 2 diabetes after 40 years. तो ये सारा जो है, ये मदर में जो है तो पॉजिटिव चेंजेस के लिए ब्रेस्ट फीडिंग जरूरी होता है. And what is the importance of this breastfeeding for baby? So for baby, so many diseases can occur if we are not giving them breastfeeding, breast milk. तो breastfeeding और breast milk, ठीक है? तो gastrointestinal diseases, or some allergies or asthma, diabetes, obesity, some cancer, then respiratory tract infection or urinary tract infection. So this to prevent from all these diseases, we should give the breastfeeding. Okay, and this breast milk, it is the complete food, we can say. It is better food, it is hygienic, as there will be no contamination in the breast milk. It is more easily digestible, it is environmental friendly, easily available everywhere. So that's why the baby should give breastfeed, and it will improve immunity also. बेबी की इम्यूनिटी जो है वो इम्प्रूव होने के लिए भी इसकी जरूरत है. ओके, अंडरस्टूड बेटा? डू यू अंडरस्टूड?
Yes, ma'am.
So the remaining part I will take it tomorrow. Most probably बेटा मुझे ना टाइम नहीं मिल पा रहा है कंप्यूटराइज करने के लिए, तो मैं जो हैंडमेड है और ये है तो भेज दूं क्या आप लोगों को नोट्स नर्वस सिस्टम के, एंडोक्राइन सिस्टम के? मैं इसमें से भेज देती हूँ क्योंकि मुझे ना टाइम
Okay, ma'am.
कंप्यूटराइज करने के लिए. ओके,
Okay, ma'am.
today I will send it. Okay. Thank you. Hey,
Thank you, ma'am.
1 minute. I am going to take you a screenshot. Okay, thank you.
Thank you, ma'am.